to show the media our readiness for COVID-19. We'd already established our wards and our quarantine facilities in that specific hospital, and on the way there, I got the news that our first positive case was identified. That was really the moment that said to me, we are in this thing. But moving sort of earlier on, 2 weeks, we'd already started with our disaster management teams. We'd already started with establishing our new management models of Sundays, where we would do strategy. Mondays, Wednesdays, and Fridays, we would meet as a cabinet, but not just as a cabinet, as a full extended cabinet, including our municipalities, the City of Cape Town and our district municipalities, the mayors and the municipal managers, and all of our heads of departments. Included was South African Police Services, so that we could actually get a grip on the full management of COVID-19. I also think about those early days when saying to this team, what I didn't want to do was run out of beds, because we'd seen what was happening in the Northern Hemisphere and we could learn from other parts of the world. We saw that people were in parking lots and in passageways in hospitals, and I didn't want that to happen. We also saw in parts of the world that coffins were piling up. So you had the spectrum of people waiting for care and people dying and everything in between. And we had to make sure that we had a response for the full spectrum for COVID-19 in our province. And we set about doing that. And here we are, still busy with managing COVID-19, but 8 months later, and we showed that as a government, we managed to produce an 862-bed hospital in our CTICC, our convention center. We produced that in 6 weeks. But not just one hospital. We produced 4 hospitals in our province in the matter of weeks. This showed us as a province and as a management team that we could really do things in a very different way and very efficiently and speedily. We also produced a partnership with the taxi industry, something that you would have thought of beforehand, government and taxis. We were always at each other's throats, but here we built a partnership called the Red Dot Taxi System, where more than 70,000 nurse trips happened, where nurses were actually conveyed from their homes safely to their hospitals or places of work and back home again during curfew and during times when frontline workers were feeling under huge pressure. We managed to build a partnership that is going to change the way public transport works into the future. Then when it comes to medicines, we know that people queue from 4 o'clock in the morning at our clinics and our hospitals, specifically elderly and people with comorbidities. These people were at risk during COVID-19 and during the peak of the pandemic. So what we did was we put a partnership together, and we now deliver medicines to your home. More than 700,000 medicine parcels have been delivered to people at their homes, changing lives forever. People will no longer have to queue early mornings to go and fetch their medicines at our clinics and hospitals. They will be delivered at their homes forever. If I think about innovation, nasal oxygen, while people were looking at how do we save lives in our hospitals, we were looking at the rest of the world running out of ventilators, and we came up with nasal oxygen supply, high pressure, and we were actually able to give high-end care to people just even in ordinary hospital beds, changing things forever the way that things were done. We made sure we didn't run out of oxygen. We made sure that we delivered food across the board. We delivered more than 15 million food parcels between government and the private sector. In our schools, we made sure that school children continued with their feeding. Despite pressure from national government and other provinces stopping feeding, we continued through this whole pandemic to feed children at our schools. We made sure that we were also open and transparent with our communication. From day one, kept the citizens up to speed on what was happening with this virus. We established a dashboard that was updated every single day. And this was used by business, by citizens, to understand what was happening across this province. And this dashboard, incidentally, has now won a silver award, competing with private sector in innovation and tech across our country. And our dashboard in government won a silver medal for the work that our department has done in that space. We made sure that our management was wall-to-wall across the province, and we still do that. Even though we've flattened the curve, we still run monitoring across our province wall to wall. But now we're moving into the next phase, which is continually making sure that COVID-19 is flattened and monitoring, but now it's the recovery stage. And as a government, we've now chosen 3 sectors that we will focus on. The first is jobs, and jobs now. We've lost 321,000 jobs in our province, and we have to claw every single one of them back. We've got to cut red tape. We've got programs where we've put 27 million rand in place so that businesses, small businesses, can have access to the funding to get their businesses up and running again. We've helped our artists with funding so that they, during lockdown, could continue to feed their families. We really are cutting red tape to make sure it's easy to do business so that we claw back those jobs that we've lost during COVID-19. Safety, the second focus of our government. And one of my key mandates from day one in being elected to the province and being elected and putting my cabinet together. And we will continue with safety. We put the first 500 law enforcement officers or LEAP officers in place, and I mean that was one of my most exciting moments in the last year when I watched those 500 law enforcement officers march in to the Athlone Stadium in time and looking at the sheer volume of officers and knowing that they were going to be deployed into communities where gangsterism is rife, where murder is high, and our target is to halve the murder rate. Continuing with the rollout of our safety plan, but it's not only boots on the ground. It is also violence prevention, going to the causes. And every single minister in our government has got a safety priority. And every single department is focusing on making sure that we are getting a grip on violence prevention, stopping the causes so that we can halve the murder rate in our region. And then the third focus area in recovery is one of dignity. I said to you that we delivered millions of meals and hundreds of thousands of food parcels during the height of the pandemic. But this COVID-19 and the recovery is going to be with us for months and months and months to come. We've got to continually making sure that dignity is amongst our citizens. That is food on the table if you've lost your job. That is dignity if you've lost your job, and understanding that our support is there to make sure that you and your family will be looked after. It is delivering more than 200 schools, more than 2 million sanitary pads to make sure that our young girls are looked after and there's dignity in the system. Dignity, safety, and jobs now. That is the focus of our government going forward over the next 100 days and medium term, to make sure that as a government we can show that we offer real hope and we offer real change to citizens of our province, and showing that where the DA governs, we make the real difference and the real change. I thank you.